Biggest challenge for managing anesthesia slash sedation for pediatric patients. Personally, I would say step number one would be managing the expectation of the parents. I always strive to have very realistic expectations. I strive for as low of expectations as possible and over deliver. And some of those expectations that I feel like parents need to be aware of is this isn't like in the movies where you take one little sip or one little sniff or one little shot, whatever form you're doing, and poof, instantly, we're like a cartoon where, perfectly still and everything's great. And that picture's unrealistic. And for the doctors out there that are doing oral conscious sedation with peds, or minimal conscious sedation, the level of responsiveness of those kids, it can all be different as well. And so I always want to have a realistic expectation from parents in regards to that. And then the other element is a realistic expectation of the risks. And for those of the docs, those of us that are doing minimal, moderate sedation, we have the saying, if you never have a failure, i.e., having to terminate the case, it doesn't work, you're not able to achieve the level of sedation to be able to perform the treatment. If you never have a failure, you probably aren't doing minimal or moderate sedation. You need to check that. And that's the other realm of expectation. I pretty much will go into every single case, pediatric case, with a parent with that conversation of, I'm not going to guarantee that this 100% will gain the level of sedation that is safe for your child and allow me to perform the treatment as we have decided that needs to happen. If that does happen to where we are not able to achieve that, that does not mean that we get angry, upset at the parent or angry, upset at the child. It just means data. It means data that we now know, okay, we have tried this does not work, and now we know the next level has to be achieved. And so going into that, then it's a reason if it happens versus an excuse if it happens and the parent is blindsided by it.